Members of Parliament, support staff, radio listeners, TV viewers, all following this meeting via social media, members of the media, ladies and gentlemen, good morning. Welcome to this public meeting of Parliament, public meeting number 16 for today, Wednesday, May 7th, 2025. At this time, I want to give a special word of welcome to the Honorable Minister of Public Health, Social Development and Labour, Mr. Richnel Brug and his support staff. We have established a quorum of 12 members. Please stand for a moment of silence. Thank you. I have received messages or notices rather, of lateness from the members Ottley and Peterson. Are there any notifications from the floor? That does not appear to be the case, so we continue with the agenda points for this meeting. The first agenda point being incoming documents. And the second agenda point, deliberations with the Minister of Public Health, Social Development and Labour regarding recent developments in mental health care on St. Maarten. This document is registered under IS 630-630, and it is dated February the 20th, 2025. It is an agenda point requested by the members Ottley, Lacroes and York. Before going over to the agenda points, this is a public meeting of Parliament, so I wish to remind the members and all present of the possibility of interruptions during public meetings. And in accordance with the guidelines, the following will apply. It is up to the chairperson to permit interruptions, and these interruptions should aim to 1. Seek clarifications, B. Challenge assertions, or contribute additional information. However, whichever one, they should always be brief remarks and without any introduction to the topic or to the interruption. So, going over to agenda point 1, we have the incoming documents, as I mentioned, and these are incoming documents from the numbers 798 through 853, and of course of the parliamentary year 24-25. Are there any comments on the list of incoming documents and the proposal for handling these documents? That does not appear to be the case, so this list and the proposals for handling the incoming documents are hereby approved. We go over to agenda point number 2. As I mentioned during the introduction, the agenda point is deliberations with the Minister of Public Health, Social Development and Labour regarding recent developments in mental health care on St. Maarten. This is IS 630. This request was received on February the 20th, and it was a request from the members of Parliament Ottley, Lacroes and York. And these members of Parliament requested that a public meeting of Parliament be convened to discuss the aforementioned agenda point. And it was also requested that the Minister of Public Health, Social Development and Labour be requested. Hence this meeting today in the presence of the Minister. At this time, I look to see if any of the requestors would like to elucidate the request as put forward in IS 630. Members, we have MP Lacroes is going to take the floor as a brief introduction to the request as made. MP Lacroes.
A blessed morning, Madam Chair Lady, Griffier, Honorable Minister, your support staff, my fellow colleagues, those in the Tribune, and those watching on social media. Madam Chair Lady, the After the meeting that we had, the work visit we had at the Mental Health Foundation, we were left with a lot of questions on where we're going and what are the plans of the minister when it concerns the mental health issues on St. Maarten. And hence, we requested this meeting to get a proper update, not only for the members of parliament, but also the public, that they would know what is happening and where the minister is planning to go, and that the minister could hear the suggestions from the members of parliament moving forward. Thank you, Madam Chair Lady.
Thank you very much, MP Lacroes, for that introduction to the request for this meeting. And we now will continue. I don't see any other requester having anything to add to the introduction by MP Lacroes. So that means we can now go over, and I will invite the minister to, I realize he has a presentation, the minister has a presentation stating recent developments, mental health care. So Minister, I invite you to make your presentation on this topic. Minister Brug.
Blessings, ladies and gentlemen, St. Maarten, Madam Chair Lady, members of parliament, support staff, people sitting in the tribune, and persons joining online. Madam Chair Lady, before I go into the presentation, I would like to, with your permission, to make a brief announcement with regard to, this is Nurses Week. I would like to congratulate the nurses as they celebrate Nurses Week, and tell them thank you very much for the services that they have been providing to this country. We know that many are called, few are chosen, and that their dedication and their work has not gone unnoticed, and we appreciate them from the Ministry of VSA and the government of St. Maarten. Thank you. Going back to the presentation, I would like to use this platform to thank members of parliament for the opportunity to have this discussion this morning. Mental health is a serious problem within our community that requires a joint effort and a comprehensive approach. For this reason, I would like to acknowledge the two previous ministers, Minister Omar Ottley and Minister Veronica Janssen, for their efforts in raising awareness on and their contribution on this topic. On another note, policy and legislative-wise, we are nowhere near where we need to be as a government to be able to respond to the needs of the community. As minister, I am committed to making the ideas and drafts that were initiated under the two previous ministers a reality by pushing forward the necessary policy developments, legislative changes, and implementation strategies to ensure that the needs of our community are adequately addressed. This is one topic that I for sure am not playing politics with. And for that, I want to acknowledge the way that the House of Parliament has also joined in the discussion in helping to raise and bring awareness on this topic. The topic of mental health is an extremely broad one that touches so many different areas. Personally, I believe this discussion this morning will be one of many on this topic. Also, I think we might have to divide this broad topic into subtopics, as the matter of mental health is a serious one in St. Maarten that needs our urgent and complete attention. Because mental health is a St. Maarten concern and not a VSA problem, a mentally healthier St. Maarten starts with all of us. What is mental health? What does it stand for? If we look at the definition of the World Health Organization, mental health stands for a state of well-being in which every individual realizes their own potential, cope with their normal stress of life, can work productively, and is stable to contribute to their community. Social determinants of mental health. All of the listed social determinants, such as access to food, quality education, a safe working environment, and stable housing, are deeply interconnected and collectively shape an individual's mental well-being. When these fundamental needs are met, they create a foundation of stability, self-worth, and a sense of purpose. On the contrary, when these areas are lacking, such as in cases of unemployment, poor living conditions, or limited access to healthcare, it can lead to a chronic stress, anxiety, and feelings of hopelessness. Each factor, whether directly or indirectly, influences a person's mental state, making it clear that mental health is not a medical issue, but a social one. State of mental health in Sint Maarten. Taking the previous slide into consideration and applying it to the current state of society in Sint Maarten, several key factors contribute to the alarming rise in mental health challenges on the island. Firstly, cultural stigma and deeply rooted societal barriers continue to prevent many individuals from seeking the care that they need. Mental health remains a taboo subject in many communities, leading to widespread underreporting and untreated conditions. Secondly, the compounded trauma of Hurricane Irma, followed by the aftermath of COVID-19 pandemic, has not only affected our society physically in terms of housing, finances, and employment, but has also pushed many individuals to the brink of emotional and psychological despair. In this context, for many others, unemployment, lack of access to proper care, and insufficient social and financial support continue to serve as a significant barrier to seeking help, whether directly linked to the aftermath of Hurricane Irma, COVID-19, or as separate ongoing challenges. As indicated in my introduction, mental health is an extremely broad topic that not only touches different sectors, has different subtopics, but also touches the different organizations and types of addictions. For this initial meeting, I will share some of the data from the Ministerial VSA and Mental Health Foundation as it relates to involuntary admission. Data from private therapists and other foundations such as Turning Point, for example, are not included. However, I do think soon we must include data from all key stakeholders that contribute in addressing mental health challenges in Sint Maarten. I will now go over to some basic data that supports the previous slide. The overview on the screen is from the past 3 years and the first quarter of 2025. In 2022, there were 29 cases reported. In 2023, there were 35 cases reported. In 2024, there were 28 cases reported. For the first quarter of 2025, there have been already 14 cases reported. What stands out at this moment is that this is a result that reflects already 50% of the total of 2024, only in the first quarter. The next slide provides an overview of the number of patients treated by Mental Health Foundation from 2021 to 2024. This overview shows a gradual increase of 791 cases in 2021 to 896 cases in 2024. However, it only shows the cases that Mental Health Foundation dealt with. It does not give an indication of the increase of patients receiving services from private therapists and their increasing waiting lists. The following sheet gives a detailed overview of the Mental Health Foundation patients. As you see, there has been an increase of 105 patients from 2021 to 2024. I would like to ask the honorable members of Parliament to take note of the age group 15 years and under. There is an increase of 159%. While looking at this chart, what is also alarming is the significant number of treatments that were provided to patients. Admission treatments went from 990 in 2021 to 1,705 in 2024, while daycare treatment went from 2,968 in 2021 to 6,253 in 2024. The following slide provides a clearer view of the increase in patients who are under the age of 15 that were treated from 2021 to 2024. 2021, we had 151 persons treated. 2022, we had 102. 2023, 108. 2024, 132. All patients under the age of 15. In looking at the state of mental health since I was sworn into office, these are the main challenges we are facing as it relates to being able to tackle mental health. A major challenge is the lack of skilled mental health professionals on the island. This is due to either their unavailability or the slow administrative process involved in securing employment. On top of this, the salary offered is not attractive enough to draw in more qualified individuals. Another significant issue is the stigma and the cultural barriers that prevent many people from seeking care. Alongside this, we face the problem of weak data and monitoring system, which hinders our ability to effectively address mental health needs. There is also a lack of sufficient public awareness and prevention programs, for which worsens the situation. Moreover, outdated legislations and policies, or sometimes the complete absence of relevant laws, continue to limit the progress we can make in mental health care on St. Maarten. Lastly, the absence of a proper mental health care facility is a critical gap that needs immediate attention. I would like to now share with you initial findings as an assessment carried out on behalf of the ministry as to the state of affairs of mental health in St. Maarten. The capacity assessment's main findings are as follows. Capacity assessment finding number 1, there is an incomplete coverage of mental health care needs, which entails not all care activities provided are registered at Mental Health Foundation. B, mental health care is also provided outside of Mental Health Foundation. Lastly, C, some mental health services are not available on St. Maarten. Capacity assessment finding number 2, there are hidden mental health care needs. This entails stigma associated with mental health. B, low literacy about mental health. C, cultural beliefs affecting help seeking. D, lack of qualitative services and choice. E, poor prevention and insufficient lack of early detection. F, also practical barriers like patients' mobility and work hours. Lastly, the lack of reimbursement of certain treatments. Capacity assessment finding number 3, population demographics, challenges with aging population. This entails A, St. Maarten is dealing with an overrepresentation of people ages 50 to 60. B, we have a small working population base. C, our island is dependent on tourism, which affects its stability. Lastly, the migration after disasters reduce our workforce. Capacity assessment findings number 4. Looking at the capacity issue, which entails the Mental Health Foundation is the main and sole provider. B, if mental health is not an option or funding is not an issue, there are long waiting times for treatment. C, there is a shortage of psychiatrists, psychologists, and specific psychiatric beds. Lastly, which leads to the need of more psychologists, specialized nurses, and dedicated facilities. Next one. Yes. Capacity assessment finding number 5. Rising demands, which entails there has been an increase in both the number of patients and the need for treatments. B, additionally, there is a higher prescription rate. Lastly, furthermore, there is a greater awareness and demand for mental health services in the post-COVID-19 era. Capacity assessment number 6, patient trend. This entails there was a slight increase in the number of patients, rising from 735 to 850 between 2017 and 2021. B, alongside this, there has been an increase in the number of treatments provided per patient. Lastly, C, additionally, there has been a noticeable shift towards more outpatients and ambulatory care. Capacity assessment finding number 7, clinical care occupation, which entails A, the occupancy rate in clinical care standards at 50%. And lastly, there are ongoing issues with room availabilities and the mix of patients. Capacity finding number 8, integral care needs, which entails there is a growing importance of holistic, community-based approach to care alongside specialized treatment. And finally, B, collaboration among general practitioners, specialists, and social services is essential to provide comprehensive care. Capacity finding number 9, perception and legislative needs, which entails there is a clear need for modernized legislation to address the current mental health challenges. B, while there is a positive outlook on community-based approach, there is a need for more clarity in their implementation. C, public awareness and prevention activities remain insufficient, further hindering progress. D, youth mental health has been largely overlooked and requires more attention and focus. E, there are currently no facilities for forensic care, which creates a significant gap in services. And lastly, there is a need to improve the mental health care facilities community image to foster trust and engagement. These were all the main findings with regard to the capacity assessment that was carried out. Madam Chair Lady, that was the first part of the presentation that basically states the state of mental health on Sint Maarten. The second part is how we intend to move forward with it. In this presentation, we will focus on the short and midterm needs. The short and midterm needs. Sint Maarten mental health services are currently insufficient to meet the growing demands. Significant enhancement in staff, facilities, public awareness are required to meet future needs and aligned with international norms. Even though it is easy to say, the real question is, how do we actually achieve that? This will be achieved by prioritizing two key focus areas when it comes to mental health care. First, finalizing the National Mental Health Strategy Plan, and two, the completion of the mental health facility funded by the Trust Fund. With regard to the national plan, the National Strategic Plan for Mental Health focuses on the building a stronger, more sustainable foundation for mental health care in Sint Maarten. This includes key pillars such as improved governance, the development of a comprehensive strategic plan, and targeted training for professionals in the sector. Additionally, it involves updating legislations and financing mechanisms with particular attention to addressing the gaps in substance abuse treatment. Prevention and promotion efforts are also central to this strategy, aiming to reduce stigma and encourage early intervention. In parallel, the Ministry is working to improve overall service capacity and quality of mental health care. This includes strengthening treatments and referral protocols, enhancing screening process, and building mental health care expertise across the care chain. A major component of this effort is the design and construction of the multifunctional mental health facilities. This facility aims to improve the quality of care and management of cases within the short to medium term, even with the same numbers of patients. 2, expand the range of services offered to include treatment for all mental disorder, including those related to psychoactive substance use. Together, these efforts mark a significant step forward in addressing the growing mental health needs of the population. To support the implementation of these initiatives, the government has engaged the Trimbus Institute through the TWO funded source, the Trust Fund, and the World Bank's technical assistance to help strengthen the mental health care system on Sint Maarten. The Trimbus Institute is an independent, non-profitable scientific organization based in the Netherlands, specialized in mental health and addiction care. It also serves as the World Health Organization Collaborating Center for Mental Health. Looking at the project activities of the Trimbus Institute, component 1 of the project, supported by the Trimbus Institute, is dedicated to strengthening the national mental health care system. This comprehensive effort is built around 4 key pillars. Pillar 1, we focus on strengthening mental health governance capacity. This involves improving leadership, policy development, and coordination within the mental health sector, ensuring that the right structures are in place to support long-term progress. Pillar 2, the project provides technical support for updating mental health legislation and the financing system. With the help of expert guidance, we're working to revise outdated laws and develop a more sustainable and effective financing model for mental health care. Pillar 3 involves mental health promotion and prevention activities. These efforts aim to raise awareness, support early detection, and prevent the development of mental health issues across the broader community. Finally, Pillar 4, we are committed to improving treatment and referral protocols and enhancing the mental health expertise across the care chain. This includes developing evidence-based guidelines, strengthening collaboration between care providers, and offering targeted training and education for professionals throughout the mental health care chain. Thanks to ongoing support from Trimbos Institute, our own stakeholders, and our dedicated civil servants, we are pleased to report that we are well on track in achieving the tangible goals set out in this component of the project. Looking at the current delivery time, we can identify several key activities and their scheduled implementation period. The successful collaboration of all stakeholders and relevant government departments remained essential to ensure smooth progress, particularly as we approach the midpoint review stages of key activities. From the chart, you can see the deadlines. So, for example, strengthening mental health governance capacity. It is expected to be finalized on June 28, 2027. Strategic mental health plan, expected to be finalized on June 30, 2025. Training programs to enhance governance capacity, expected to be finalized July 30, 2025. Technical support for VSI to support the development of mental health legislation, expected to be finalized July 1st, 2025. Financial analysis, cost of services, cost-benefit analysis, expected to be finalized January 28, 2026. Now moving on to the second part of the plan, to improve mental health care on Sint Maarten, the Mental Health Foundation facility. While strengthening the broader mental health system is essential, these reforms must go hand in hand with improvement to the core infrastructure that delivers care on the ground. That brings us to the current state of Mental Health Care Foundation facility and its most urgent issues. At present, the facility does not meet the basic standards required to provide safe, effective, and dignified mental health care, not for patients nor for staff. Some of the most pressing concerns include several environmental and structural issues such as mold, sewage problem, and a lack of daylight and proper ventilation. Many patients' rooms are without air conditioning, making it unsafe and uncomfortable, particularly in our climate. Inadequate bathroom facilities with limited toilets and showers that are often shared between patients, compromising hygiene and privacy. Critically, the building is not hurricane resistant and would not withstand a Category 3 hurricane, a Category 3 storm or higher, a serious risk in this region. Not only that the current building is suffering from in addition, the current building is also suffering from severe structural damage. Furthermore, the lack of separation between patient groups severely impacts operational capacity. For example, when the admission ward is occupied by male patients, female patients in need of urgent care cannot be admitted due to the safety and privacy concerns. No facilities for the youth, and no separate entrance. The building is too small for the staff. The Mental Health Foundation has to additionally rent the building next door for housing its staff. These conditions not only undermines the quality of care, but they also contribute to staff burnout and limit the ability to respond to mental health needs on the island. Addressing these issues is not just a matter of infrastructure. It is a matter of human right, patient safety, and the long-term resilience of mental health care on Sint Maarten. To start addressing some of the issues, in June 2024, the COM made a decision to grant Mental Health Foundation 1.5 million guilders and 1.5 million guilders in 2024 and 1.2 million guilders. Okay. Stand corrected. In June 2024, the COM made a decision to grant the Mental Health Foundation 1.3 million guilders in 2024 and 1.2 million guilders in 2025, with an approved budget for 2025. So a total of 2.5 million guilders was approved in June 2024. Unfortunately, we discovered that after approval of the 2024 budget, by the COM on June 18, 2024, that an advice was not prepared to be able to disperse the funds to Mental Health Foundation. But if you want to know, one second, Madam Chair. Okay. All right. Go ahead. Okay. That is it for that part? Okay. So move on to the next one then. Okay. This new facility must. Yeah, they didn't know. Okay. Are we on track to finish this building on time to be able to cater to the needs of our community? This new facility must be lean and mean, a multifunctional center, guarantee continuity of care for all current services. So are we on track? The question is, the answer is no. Unfortunately, no. Immediately after swearing in as minister in November, I met with management of NRPB to receive a full debrief on the status of this project. This meeting took place the first week of December. During this meeting, management was adamant that the project is on track and is not encountering any delays. Upon hearing this during the meeting, and knowing that up until now, all NRPB projects have encountered delays, as a ministry, we felt the meeting with a sense of, we left the meeting with a sense of uncertainty. As a result, sorry, Madam Chair, one second, let me make some correction. Thank you very much. I'll repeat the other part. During this meeting, management was adamant that the project is on track and is not encountering any delays. Upon hearing this during the meeting and knowing that up until now, all NRPB building projects have encountered delays, as ministry, we left that meeting with a sense of uncertainty as a result of limited information shared. Immediately after this meeting, I requested technical assistance and advice on the current state of this NRPB project. While this assessment is not fully completed, initial conclusion based on the limited data provided by NRPB shows the following. There is indeed a delay in construction of the building. Initially, this delay was denied by NRPB, but was later acknowledged. Based on current projection, what I must note are derived from the limited data provided by NRPB. I, as Minister, now anticipate a delay of 3 to 4 months. This delay is further complicated by additional challenges. The main focal point of the Ministry of VSR, who has been working at 50% capacity on this project, is set to leave the ministry in the coming months. This departure leaves the ministry without a dedicated focal point, and more critically, without a staff possessing the specialized technical knowledge necessary to manage this particular project. Furthermore, the ministry will be left with a gap in understanding NRPB's operation and functions, which is essential for the continued success of this initiative. Communication and reporting protocols will be strengthened to ensure transparent and efficient project implementation. The NRPB will be required to submit detailed monthly or quarterly progress reports outlining implementation timelines, budgets, milestone achieved, and any identified risk. In addition, periodic government review meetings will be held to assess progress and address any emerging issues. To further enhance coordination, the Ministry of Public Health will appoint a dedicated focal point to serve as the main liaison between all parties. To prevent further delays and reduce the impact of projected setbacks, the following steps will be taken. Approval processes will be streamlined to eliminate bottlenecks. Government departments responsible for issuing permits, license, and workforce approval will fast-track procedures specifically for NRPB projects. This will ensure more efficient and coordinated approach across agencies. The NRPB will also be required to engage in integrated projects planning by involving all relevant ministries early in the planning phase. This proactive engagement will help secure necessary approval well in advance. To support both the NRPB and the Ministry of Public Health, VSR, a dedicated technical coordinator will be appointed. This coordinator will monitor progress, provide assistance, and ensure alignment with government expectations. These measures are dedicated to strengthening transparency, communication, and efficiency while holding NRPB accountable for its responsibility. The ultimate aim is to align the NRPB's work more closely with national priorities and ensure smoother and more effective project implementation moving forward. It is important to note, however, that the success of these actions depend on how quickly the departments can recruit additional technical support. In the meantime, it remains essential to continue strengthening communication lines with NRPB to ensure steady progress in our country. Thank you very much, Madam Chair Lady. Madam Chair Lady, I'm practically reaching to the last part of the presentation. And this part is basically indicating what this ministry has done since I have been there from November 26, 2024. In the next 3 slides, I will focus on mental health initiatives carried out so far by either my person, the cabinet, or the ministry since being sworn in on November 26. The first one was the Men's Circle. The Men's Circle is an initiative by the Department of Community Development, Humanitarian and Family Affairs aimed to support and empower men in various aspects of their lives. The program addressed important topics such as challenges men face in expressing their mental and emotional state, legal and practical information for fathers regarding guardianship, the role of men in relation to faith, and the importance of becoming a positive role model for the young generation. The first edition took place in 2024 and was met with great engagement. A follow-up session is scheduled for fall of 2025. In addition to that, we did collaborate with Victorious Living Foundation, with Dr. Cotton, regarding a suicide prevention session in January 2025. This suicide prevention session was streamed online and recorded. DCOM made several short clips on these sessions that to date are still being viewed on the government Facebook page. In February, I agreed to collaborate on a number of mental health projects with Men's Mental Health Awareness Foundation. The first initiative we are contributing to is the Interscholastic Spoken Words Competition. Next to that, via the ministry, Trimbus organized mental health soundboard sessions with the aim of gathering initial inputs from stakeholders. These sessions also serve to raise awareness among organizations and NGOs on each other's initiatives, to promote collaboration, and to work collectively towards a shared vision for the future. In April 2025, an Autism Awareness Symposium was organized by the Spectrum Support Box. This successful symposium is the first of many activities that the ministry will collaborate with Spectrum Support Box this year to educate our community and raise awareness. Immediately after being sworn in as minister, it became clear that the majority of the staff felt tired, demotivated, and some on the verge of burnout. I immediately requested a quick scan assessment by psychologists who had previously worked with 2 departments within VSR. My chief of staff, based on her background in personnel and organization management, also conducted a quick scan based on 1, the different interviews with SG, management team, staff members, and the union. 2, the psychological quick scan. 3, the employee satisfaction survey carried out in 2023, specifically for VSR. Based on the outcome of these quick scans, a decision was made to prioritize not only regulating the function books of staff, but also the mental health of our VSR personnel. Since then, the following initiatives have been taken. Together with Staff Bureau, my cabinet and I organized Sports Day in February that was divided in two sessions, focusing on physical and mental health. My cabinet, Staff Bureau, in addition, my cabinet, Staff Bureau, management team were provided with sessions from psychologists that focus on recognizing personal signs of being overworked and signs in staff. In addition, in March 2025, 2025, a COVID-19 Appreciation Day was organized. The main purpose of this day was to recognize the work that VSS staff does, not only during disaster, but throughout the entire year as frontline and essential workers. Based on the ongoing recommendations from the 2 quick scans carried out in December and previous discussions with VSS staff, it was decided to establish recovery or lounge areas at 3 locations where VSR personnel are housed. These locations are the ambulance department, the Vineyard building, and on the 2nd floor of the government administrative building. Currently, furnitures have been received for 2 of the 3 locations, and these rooms are currently under construction. Lastly, one initiative that I am particularly proud of, made possible with the support of my SG, is the introduction of the immediate psychological support for VSS staff. In early April, I approved a proposal allocation of 35,000 guilders to ensure that any VSI employee in need of urgent psychological assistance can access these treatment from a qualified psychologist without having to go through long waiting lines. I can boast and say we are probably the only ministry that has that. Continuing, as most members of Parliament are aware, and probably the public as well, this is Mental Health Awareness Month. It's also one of the reasons, well, I've been wearing the pin since I've been a minister, that I received from mental health. For this month, I would like to indicate to the members of Parliament and the public that we have 5 projects. We will collaborate with Spectrum Support Box via an online workshop entitled Parenting Through Challenges in Mental Health and Raising Children with Disabilities. This is on May 14th. We will provide a workshop entitled When to Ring the Bell, Supporting Youth Mental Health on May 24th at the Government Building, where you will learn on how to recognize the signs, start conversations, and know when it's time to step in. This will be very informative for parents, caregivers, foster parents, teachers, youth workers, and anyone supporting a child or a teen. A next collaboration is the Interscholastic Spoken Words Competition organized by Men's Health Awareness Foundation on May 31st. Also, my cabinet is in the process of organizing informative mental health videos for youths. This project will be launched in May and last throughout the year. Lastly, the Trimbus Institute will continue this month with their soundboard session with stakeholders. With this, Madam Chairlady, I have reached the end of my presentation. As mentioned in the beginning, this has been a brief synopsis highlighting the most important aspects of the current state of mental health on Sint Maarten. It is imperative that both Parliament and government continue to work together in addressing this shared challenge, one that impacts not only the Ministry of Public Health, VSA, but extends across all ministries. A collective and coordinated approach is essential to making meaningful progress in improving the mental health of our nation. Thank you, Madam Chairlady. I will now await any further questions or any questions from the Member of Parliament. Thank you.
Thank you, Minister Brugge, for that presentation. Members of Parliament, this is a public meeting of Parliament, and thus, in order to speak, one would have to sign in the speakers list. A reminder that the allotted speaking time is 20 minutes in the first round and 10 minutes in the second round. Before going over to the speakers from the side of Parliament, I'm going to adjourn for 3 minutes and allow everyone to collect their thoughts, get their presentations together. So I'm going to adjourn this meeting for 3 minutes. Meeting adjourned for 3 minutes. Members of Parliament, ladies and gentlemen, Minister Brugge and your support team, welcome back to the continuation of this public meeting of Parliament addressing or deliberating on the issue of mental health. We have received a presentation from the Minister with respect to information and data regarding mental health on St. Maarten, as well as some proposals and projects that the government and the ministry are working on to address the many challenges as cited regarding the mental health of our population. So again, thanks to the Minister for his presentation, and now the opportunity is here for members of Parliament to ask questions, make comments with respect to the topic at hand. And the first MP to whom I will give the floor is MP Shamira Roseburg. MP Roseburg, you have the floor.
Thank you, Chair Lady. Blessed afternoon to my colleagues, to the Minister of ASI and his support staff, the ones in the public, and the ones viewing and listening online. Thank you for your presentation, Minister of ASI, and the insight that you have gave through your presentation. My questions are related to the following. You mentioned in your presentation that the technical support, that there's the deadline for the technical support for the VSI legislation is set at July 1st, 2025. Just for clarity, does that mean that that is the finalization of the mental health legislation, that is set at July 1st, 2025? My other question is related to the motion that was passed in January 2025 in regards to the National Ordinance on the supervision of the mentally ill persons. As we all know, that legislation is outdated, and that new legislation will be put in place and cover that legislation of 1922. But seeing that the legislation is outdated, a motion was passed, and it was decided at the Ministry of ASI to adopt and formally adopt and implement the draft policy to cover that current gap. And that draft policy would have to be implemented within 6 months. Just for public knowledge, in that motion, it was mentioned that in the policy, the access to legal aid, the mandatory judicial review, ensuring that all provisional placements or detention decisions are subject to judicial review within 5 weeks, implementation of conditional mandates, so provide a legal basis for the voorwaardelijke machtiging, the conditional mandate, to allow outpatient care under specific conditions, such as adherence to prescribed treatment and regular contact with the mental health foundation outpatient team, and also the option to second opinion for medical declarations. It was mentioned in the motion to direct the Ministry of ASI to expedite the finalization of amendments to the Krankzinnige Landsverordening and ensure the updated legislation includes, of course, legal provisions for mandatory judicial review, legal framework, safeguard for impartial medical assessments. Also in that motion, it was mentioned to allocate the necessary financial resources to fund the legal aid services as proposed in the draft agreement, and also to establish a monitoring and reporting system to oversee implementation of the temporary policy. So that all in connection and in collaboration with the Ministry of Justice. Though seeing that we're currently in May, and also seeing that based on the presentation it was mentioned, the technical support will be finalized July 1st, and not sure if that is also the finalization of the legislation. I would like to know through you, Madam Chair, what is the current update in regards to that policy? Are we on track, seeing that the 6 months mark is reaching? And I would like to know, based on the fact that that motion has been passed, where we are and what we can expect. These are my questions for now, Madam Chair. I thank you.
Thank you, MP Roseburg, for your questions and comments. I now give the floor to MP Lewis. MP Lewis, you have the floor.
Good afternoon, Madam Chair. Good afternoon to the Honorable Minister of ASI and your support team. Good afternoon to those in the Tribune. Good afternoon to the listening and viewing public of Sint Maarten, including those here as Honorable Members of Parliament. Minister, thank you for your presentation. I've had the honor to be invited at your office as well, where we sat down and had a fruitful conversation with regards to from when you started to where you is now, when it comes to the general business and operation of the day of VSR. We did exchange some questions as well, but the people of this country today, I will rehearse some of those questions that we spoke about personally, but that the people of this country knows exactly what we are working on with regards to mental health. So, Minister, through you, Madam Chair, with regards to the mental health infrastructure and capacity, can the Minister provide an update on the current state of the mental health care facilities in Sint Maarten? Are there any plans to expand or upgrade these facilities in the near future to meet the growing demand for the mental health services? The accessibility to the services. What measures are being taken to ensure that mental health services are accessible to all residents, particularly those in remote or undeserved areas of Sint Maarten? Funding and resources. Given the increasing importance of mental health, how much of the national health budget is allocated specifically to the mental health services? Are there any plans to increase this allocation in the light of recent developments and needs? Staffing and professional support. Does Sint Maarten have sufficient mental health professionals, such as psychiatrists, psychologists, and counselors to meet the demand of services? What steps are being taken to recruit, train, and retain qualified professionals in the mental health sector? With regards to public awareness, I did hear you mention something. What strategies are being implemented to raise awareness about mental health issues among the general public? Are there any initiatives to reduce the stigma surrounding mental health and encourage individuals to seek help when needed? The collaboration with international organizations. Is Sint Maarten collaborating with international mental health organizations or neighboring countries to enhance its mental health care services? If so, can you provide examples of such collaboration and their impact? Support for vulnerable groups. How is the government ensuring that vulnerable groups such as children, the elderly, and individuals living with disabilities have access to appropriate mental health care services? Telemedicine and digital mental health services. With the increasing use of technology, is there any consideration being given to telemedicine or digital mental health platforms as part of the government's strategy to improve access to mental health services in Sint Maarten? Crisis response and emergency services. What systems are in place for individuals experiencing mental health crisis? Are there enough resources for immediate intervention and support in emergency situations? Monitoring and evaluation. How does the Ministry of Health evaluate the effectiveness of mental health care programs in Sint Maarten? Are there any plans for future assessments or audits of the mental health services available to ensure they meet international standards? With regards to COVID-19 impact and mental health, given the mental health challenges arising from the COVID-19 pandemic, what specific measures have been implemented to address the increased need for mental health support during and after the crisis? Future plans and vision. Can the minister outline the government's long-term vision for mental health care in Sint Maarten? As there are many policies or initiatives on the horizon aimed at improving the mental health landscape for residents. Certainly, here are additional questions, okay, that I can ask you as Minister of Health, through you, Madam Chair. The integration of mental health into general health care. How is the mental health being integrated into general healthcare services in Sint Maarten? Is there a coordinated approach between primary care providers and mental health professionals to ensure holistic care? The support for families and caregivers. What support is being provided to families and caregivers of individuals with mental health conditions? Are there any programs or resources available to assist them in managing the challenges associated with caregiving? As I know, within the French Republic, those that assist individuals with mental illness also get some kind of stipend or finances that can alleviate the approach of our health caregivers, especially when we are, we don't have enough of them. You have those who would stand up and say, listen, I will take care of my own, and that government will also give something to them for the work that they are doing on behalf of their family member. Mental health and youth. What specific measures are being taken to address mental health issues among the youth population in Sint Maarten? Are there school-based mental health programs or youth outreach initiatives in place? And if so, I would like to hear a few. Back in the day, we used to have something called a DARE program that was given also by the police officers. We have basically the probation office. What is government doing in collaboration with those different organizations together in order for us to reduce the risk, for example, of having youth committing suicides in the future? Treatment for substance abuse and mental health co-occurrence. How is government addressing the intersection of mental health and substance abuse disorders? Are there adequate resources for individuals dealing with both conditions simultaneously? Psychosocial support for trauma victims. In light of recent natural disasters such as hurricanes, what specific psychosocial support services are available for individuals affected by trauma? And how is the government ensuring they receive the care they need? One may ask, what do you mean? I can tell you I had a neighbor. She was an elderly person. They took them out during Hurricane Irma, for example. And when she came home and saw what happened to her home, within 2 days she was dead. Okay? People do live through certain trauma. Everybody don't take the same situation the same. Telehealth accessibility. How accessible is telehealth for mental health services in Sint Maarten, particularly for those who live in areas where physical mental health facilities are scarce? Is government exploring partnerships with tech companies to improve telehealth infrastructure? Mental health in the workplace. What steps are being taken to address mental health in the workplace? Is there any legislation or policy being considered to promote mental health awareness and well-being among employees, especially in high-stress industries? Data research on mental health. What data or research is the Ministry of Health using to guide policy development regarding mental health care in Sint Maarten? Are there any plans to conduct more research on mental health trends in the population? With that, Madam Chair, I will leave the rest for the second round. Thank you.
Thank you, MP Lewis. Members of Parliament, at this time, I don't have any other person unless they're now getting up to sign. No, that's not the case. So I look to see if anyone else is getting up. Yes, we do have MP Arian. So we'll allow MP Aaron to sign and then we continue. MP Aaron, when you are ready, you have the floor.
Good afternoon, Madam Chair, Secretary General, colleagues, Honorable Minister and his support staff, and the viewing public. Thank you again for your presentation, Minister, and the insights. Minister, some of the things he said in the presentation are, I would say, concerning, and I'm hoping that the next time we meet, that your presentation will say, these are the concerns that we had last time, and these are the concerns that we have addressed and how we have addressed them. As a matter of fact, I hope that based on your presentation, that we can see as members of Parliament just periodic updates. So on a quarterly basis, maybe send us updates and say, hey, this was our presentation. These are the things that we've done so far. And so you don't have to call a meeting every time on it, because I think these are very important topics. Given the current mental health facility cannot, as your presentation said, cannot withstand a Category 3 hurricane and suffers some structural damage, what contingency plan exists for continuity for service during the season, which is next month? The Minister mentioned, through you, Madam Chair, in his presentation, that there's limited data by the NRPB on why there were delays, etc. So my question here is, why were they, and you even mentioned that they weren't willing to share, I believe. So why weren't they willing to share, and who weren't they willing to share with? Is it they weren't willing to share with you as the Minister representing mental health? They were not willing to share with the Council of Ministers? Because I think it's very alarming that we have a ZBO that basically functions directly under government, that falls directly under the Prime Minister, and I have to hear from the Minister of ASR over mental health that the entity is not willing to share information with you, and now you can't give information to us as members of Parliament. And I think then, I'm hoping, my next question will be then, what are you doing, and what is the Council of Ministers doing to hold them accountable? So what have you done? Because it can't be that you say, okay, we can't get information from NRPB, or they're not willing to share information with us, and you have the whole steering committee there, you have the Prime Minister there. So what did you do, what did the Council of Ministers do to address the fact that NRPB were not willing to share information with you? And then you mentioned that your cabinet or the ministry, you came up with your own timeline, which I believe you said it was 4 months in terms of the delays. So how did you come up with a timeline? So what data did you use to come up with a timeline, the 4 months? And especially given the fact that you had limited data. So where did you pull this information from? And how realistic then is this 4-month timeline? The Minister also mentioned the concerns of the facility, and that it did not include separate wings based on gender and youth, etc. So given the current issues of the mixed admissions, can we assume that the new facility have all those concerns addressed? The Minister also mentioned, through you, Madam Chair, the focal point and timelines and so forth. So you're going to get a new focal point. Will the focal point be a person from the government? So under government's payroll, so a current civil servant, or because that happens in government also. We say, hey, this is going to be a focal point. Matter of fact, we've had that in the past also. Or is it going to be an external party as a focal point? And for either one, is there a budget for it? For either one, is there a budget for that focal point? Because, again, I've said this before, when it comes to this government, what we hear a lot is ideas and plans, ideas and plans, ideas and plans, and 6 months later, there's absolutely no execution, and you basically just gaslighting the public, because we get presentations, but then there's no backing behind of it. There's no support behind of it. There's no finance behind of it. So the focal point, and I ask another question, is there any legislation for the focal point? So is there, at the very least, a council of ministers ministerial decree for the appointment of the focal point and being able to, for them to actually do their work. The presentation mentions delays in the legislative process, and even the execution of certain policies. So I asked the minister, which laws or regulations specifically have been delayed? What were the bottlenecks? Was it administrative? Was it financial? Was it legal? Or was it even political in terms of having these delays? So what was contributing to these delays? Ooh. How would the ministry ensure that the findings from the Trimbo's financial cost-benefit analysis will be translated into tangible budget allocations? So we have the Trimbo's. Will we be able to see it reflected back in the budget 2025 that should be coming in June, budget 2026, and 2027? So all these effects, the cost benefits, will we be able to see it reflected somewhere in the budget? The minister also mentioned that the lack of professionals to be able to support mental health. So I'm assuming psychologists, I'm assuming psychiatrists, I'm assuming social workers, I'm assuming persons within that field, in that area. But then if you look at the VSI FTEs, they don't have enough FTEs to support this, right? So you need more FTEs to be able to hire these if you want to work for government, right? So you need more support in government. So are you addressing the FTEs within your ministry? You also mentioned that your staff are basically overworked. Are they overworked because they need more support? So they need more staff to be able to do more work. And if that's the case, then going back to the question prior, are you then addressing the FTEs within your ministry? And what does that timeline look like? What does that process look like? When can we see some update on FTEs? And my advice would be, if you do believe it's that urgent, don't wait until the COM says we can do it as one package. No, just like Justice did, do your own package and your own timeline. In your presentation, there's a point about the hidden care needs. So how is VSR addressing the hidden care needs, especially among the aging populations? You know, in Sint Maarten, we're now having the upside-down triangle. So the vergrijzing, the grain population, I think that we are underestimating the effects of that on our population going forward, on our pension, and actually on our financial systems, period. So how is VSR addressing the hidden care needs for the aging population and the marginalized groups, or even the underrepresented, based on your statistics? And then there was an alarming rise in involuntary admissions and untreated cases in your presentation. So what measures are being taken to strengthen the outpatient and the early intervention services to reduce any sort of escalation? The minister, on one slide, you showed all your initiatives for the year. You had the event here, Spectrum Box, men's awareness, and different stuff. So one person who commented sent me a message and said, hey, there's a lot of events, but they're all done by outside bodies. But what is the ministry doing to measure the effects of these? Because yes, you have all these events, right? And for example, there's certain events I attend, and then at these events, you see the same people over and over and over. So how is the ministry actually taking account of the events, how much people are attending, right? Maybe doing surveys on the spot, doing follow-ups after, right? So how are you measuring the impact of the events? Because in 2026, 2027, when we look back on your term, we could say, hey, the minister has held 100 events based on mental health. But then when we look at society and we see no impact, then you could say, hey, were these events successful? So are you measuring in any way the impact of these events or how these events will impact society? And if you have, can Parliament be updated on how, what you have done and send to us? And if you haven't, I would suggest that you do that going forward and also send us an update on how you plan to do that. Like with other efforts in the community, when it comes to government efforts, but also NGOs and foundations, etc., we see a lot of fragmentation. So everybody has a foundation, everybody has an NGO, and of course, they're all passionate about their goal. And what we then get is a lot of fragmentation, we get a lot of dilution. So how is the minister going to consult with these NGOs and foundations and ensure that we have a cohesive policy, right, and implementation strategy? Because all of these events that you mentioned are by individuals, right? Some of them just starting up, some just open a foundation, right? So they don't even have, let's say, a track record of impact or effectiveness. So how are you as a ministry going to ensure that, hey, guys, let's come together, because we can't be all doing different events, because the public also now gets tired also, right? You're not going to get the same people attending the same events to hear the same things over and over and over, right? We don't have the resources to do that. So we have to be very, very cognizant of, hey, if we feel that these mental health is important, then we have to go for impact and not attention, right? Less attention, more impact. So how will you now gather these NGOs together and say, hey, guys, on a quarterly basis, let's execute this. Because now for sure we know we're going to get this impact. We can't have on a monthly basis different events and then we can't have any results from that. And lastly, Minister, we have, like I said, we have all the ideas, concepts, and plans, and they sound good, but we're already budgeted in 2024. So everything that you presented today, all the things that you want to do, we're already budgeted in 2024, because we don't have a budget 2025. So everything you presented, we're already budgeted in 2024, so that you're able to execute. If they weren't, can you list the ones that weren't or aren't, and the ones that are? And then list the ones that are supposed to be budgeted in 2025, because that means you're already going to be a half, like we're going to the second quarter, no, we're already in the second quarter, we're going to the third quarter already. So that means effectively everything that you had planned for 2025, you're going to execute. So explain to me the ones you have budgeted for 2025, you were not able to execute because there's no budget, because I understand that advices may be being done and they can't be executed because of budget. And then the ones that you have to execute for 2026. Because what I'm going to do on my side now is hold you accountable based on your presentation now and presentation for budget debate 2026 and say, hey, you again can't come back to me as a member of Parliament and say, hey, these are my plans. When I look in the budget, I don't see them there to be executed. Because the accountability will be there, make it known already, for 2026. That'll be useful, Madam Chair.
Thank you, MP Irian, for your presentation and questions. I continue with the members of Parliament, and the next speaker up is MP Dimar Labega. MP Labega, you have the floor.
Thank you, Madam Chair. Good afternoon, Madam Chair. Good afternoon to the Kafir. Good afternoon to my fellow colleagues, the Minister and his support staff. I'd like to thank you for the presentation and your ministry's efforts. One question. The results of the STEP analysis, I believe you stated that it should be in by February. If so, I would like the results of this analysis. That'll be all. Thank you.
Thank you, MP Labega. The next speaker up is MP York. MP York, you have the floor.
Thank you, Madam Chair. Good afternoon to yourself, honorable colleagues, Minister and support staff, and the viewing public. Minister, I would like to thank you for your extensive presentation and also the efforts put into compiling all the data from the previous years. However, I have to raise a bit of concern by what the Minister, to you, Madam Chair, did mention, the lack of stats from the turning point and from the private practitioners. Basically, that's not in absolute numbers, but that's 2/3 of the major stakeholders on the island, right? And what I would like to prevent, because also in the presentation, the Minister mentioned to you, Madam Chair, that they are working on the National Strategic Plan, and in creating this plan, it has a lot to do with policy making, law making, etc. In absence of that, of these statistics, we will have what will be created is a disparity in prevalence of the issues on the island. Because although mental health is a significant stakeholder, they're not the only stakeholder. So I would just like to mention that that's an important set of stats. I don't know if it's because they were not collected as yet or they were not completed in time to be added to the presentation. So if the Minister can elaborate on that, that would be very much appreciated. Also, the presentation provides patient treatment stats. So for example, 800 plus almost 900 patients treated in 2024, but it lacks context because the 896, does this represent the demand or represents progress? Because also in our work visit to mental health, we were explained all the different things they were doing over the years to raise the awareness, and because of raising awareness over the years, automatically the numbers went up. Is it because of that, or is it because of external factors when it comes to addiction and et cetera, that caused the significant raise in patients treated? Also, in that same slide, the Minister mentioned it twice, a couple times, the under 15 admissions. I would like to know what is the cause of that, or what are the findings of that? Because I think that was a number. The Minister did not gloss over it, but I didn't really hear the explanation of it, right? So I would like to understand what was the reason, is the reason for those numbers. Also, in the presentation, I appreciated the fact that the Minister made a lot of mention of the pending construction of the new Mental Health Institute and all the things that he's trying to do to prevent further delays. But as well, I feel a hint of over-reliance in the solutions given, dependent on the new Mental Health Institute. Right? So if we were to omit the Mental Health Institute from the presentation, I'm lacking solutions for the problems mentioned, I think, in slide 8 or page 8 of the presentation. What, besides the new Mental Health Institute, what is the ministry doing, especially on the side of prevention, right? And if we're talking about prevention, I know there's a pending SAHA legislation coming to Parliament eventually this year. I would also like to know what's in it as it pertains to mental health prevention. Because we could always talk about how we're fixing the problem, but I would like to also talk about and focus on how we're going to prevent the problems moving forward. Also, yes, a new institute is coming, but I didn't really get much solutions on the current institute, because also in the work visit, there were some alarming things that were brought to our attention, unsettling things, just to say the least, such as mold, sewage, etc. And sorry, but I came to hear what the Minister is doing or will be doing, and Madam Chair, the Minister found it necessary to point out what his predecessor didn't get done in the funds for the Mental Health Institute in 2024. if I understand correctly, he mentioned that a advice was not prepared in time for the money to be dispersed. Correct me if I'm wrong, but that literally is what the minister said. I seen a couple of head nods. So the reason why I'm asking the question is because in conversations with the prior minister, the now Honorable MP Veronica Janssen-Webster, especially at the work visit, she made abundantly clear the lengths she went through to make that money available before leaving the seat. So we could rewind the tape, but the minister literally said before he was interrupted that an advice was not prepared for a sum of 1-point-something million guilders in June of January 24. So I would like further clarity, even if either the minister or the good MP, when she comes with her contribution, can further elaborate and clarify that one point, because two members from the same party giving two different information, I would like to know what's the real story, all right? So that's pertaining to that. Also, implications of the subsidy to the mental health facility after the new mental health facility has been built. So what are the subsidy implications once a new mental health institute is live? As well, one of the prior speakers mentioned it as it pertains to FTEs going into the new mental health institute, but I would like to know what is being done as it pertains to recruitment for the mental health institute, because I would assume that we're not waiting until the institute is here to do the recruitment for it. So as it pertains to recruitment, and as well local recruitment, right? Because especially if you look at fields like psychiatry, etc., what is being done? Is there something being done as it pertains to local recruitment? As well, at the work visit, the psychiatric nurses mentioned that there's a low number of people actually venturing into the field to study. So psychiatric nursing are basically, a lot of students are not aware of certain fields within mental health to actually venture into it and study, and actually, so we have more local professionals coming back. So I would like to know what is the ministry doing as it pertains to campaigns for the students prior to them picking their studies and venturing to either the Netherlands or the States. Also, the minister referenced the discrepancy in the NRPB timeline to reality, basically. I appreciate that slide, but I would like to know, aside from the things that the minister is trying to do to prevent it, I would also like to know, are there any contingency plans in the event of them, those delays still happening? Again, so the minister explained in the presentation, to you, Madam Chair, what he's trying to do to prevent further delays as it pertains to the construction of the Mental Health Institute. I would like to know, especially seeing the history of projects from the NRPB, what contingencies does the minister have in place in the event of these delays still happening, or even more further delays? Speaking about the delays, I noticed a particular delay, not in the construction, but in the procurement. So I would like to know, via you, Madam Chair, if the minister can explain what exactly is going on there and why in just that particular phase there's, I think, a delay of almost 2 months. What exactly, if the minister can clarify what was the reason for that, or what is the reason for that? And also, pertaining to the schedule, I would like to know if the minister is in possession of the master schedule from the NRPB pertaining to the Mental Health Institute. And if that's the case, will the minister be so kind enough to share that with the members of Parliament? And if that's not the case, does the master schedule fall under the information that the minister mentioned that the NRPB is not willing to divulge? And if that's the case, I would like to know what are the plans for the minister moving forward as it pertains to procuring information from the NRPB, such as a very important document like the master schedule. And lastly, in one of the slides, the minister had 3 slides where he explained what all the things he has done since being in office. One slide being events that he's attended, a next slide being things that are to be executed, and a next slide being the things that he has done in-house to raise, I would think, the morale of the employees of the ministry. I would like to know, so I also saw psychology reports, psychology sessions, et cetera, et cetera. That's a lot of time and money invested. I would like to know what were the findings of, I would say, these sessions, these one-on-ones. What were the findings? So not on, I don't need to know this person has this and this and this issue, but what were the global findings and what has been the conclusion in sense of actionable points moving forward? Because oftentimes we do a lot of things and the boxes are checked, but the follow-up isn't there. So I would like to know, one, what was the summary of the things done, of the things found, and what are the actionable points moving forward? I saw the minister started doing yoga and different type of activities with the staff. That was nice to see. But I would like to know moving forward, what are the concrete actionable points that will basically stick with the employees moving forward, and also when it pertains to continuation, because I would assume a lot of things that were done, because I also saw that moving forward, psychologists will be made available for the staff, etc. So things like that, I would like to know what are the action points moving forward that will be continuable, along with the findings from the steps already taken. And with that, Madam Chair, just checking to make sure. Oh, yes, one more point. Stigma, the minister made mention of stigma and cultural barriers, that they present challenges and receive minimal attention. But I didn't really get out of the presentation what the minister is doing to combat that, right? So maybe the minister did mention it, but if you can clarify it or a little bit more focus on it in his answers just now, I would greatly appreciate it, because the stigma and cultural barriers, that's something that has plagued the island for decades, and a lot of investment could go into a new mental health institute or a new turning point, and eventually, hopefully, in the near future. But if we don't tackle the stigma and cultural barriers, all those investments will be minute and basically bad investments. So I would like to know, what is the minister doing as it pertains to awareness campaigns, and also outreach programs into the various districts. And I would like to know, if so, which districts will the minister be focusing on first? And with that being said, that would be it for me, Madam Chair. Thank you.
Thank you, MP York. I continue with the Speaker's List of Parliament, and I now give the floor to MP Wever. MP Wever, you have the floor.
Thank you, Madam Chair. Good afternoon to the griffier, support staff, the Honourable Minister, your support staff, my honourable colleagues, those listening live in the Tribune, and those listening via whichever media. I first off would like to thank the Minister as well for his presentation. I think it's clear. One of the things that caught my attention, though, was when you mentioned the concern you had with one of the persons leaving the ministry, which has all the knowledge of the new mental health facility. Has this person left already? Or when is this person leaving? And will we make sure that there's a overdraft being done, that everyone knows, or somebody else can be reassigned that task? Because I think there should be no internal delay in VSA when it comes to the mental health facility, or even assign someone within your cabinet minister. And as we know, NLPB executes the wishes of the government. So make sure you're the one that's leading the charge when this comes, and not NLPB telling you what you can or cannot do. And then in one of the charts, you indicated, through you, Madam Chair, the increase of persons 15 years and younger. And I know you as well I know the minister also coming from the educational background. I know the Ministry of VSA is very much into preventative care. and I know the minister as well. What is the ministry vision as it pertains to enhancing the awareness campaign within the schools? And also, is there collaboration within the Ministry of VSA and the Ministry of ECYS? Has there been meetings with the Minister of VSA and the Minister of ECYS as to an approach, how to tackle this? Because at the end of the day, we want to prevent that these persons don't receive the proper help that they need early on, you know, because as we know, a lot of the high schools have an active care team at the moment. So they have the guidance counselor, psychologists, and so forth on board. But where we're missing is within the primary school systems, right? How are we tackling those issues? Because we can't wait until someone comes to high school to then get certain attention. We need to tackle it head on from the beginning, you know, from the start. And especially within the public schools. And I know some of the schools have care teams, psychologists available, but we need to ensure that we have them stationed within the schools. And there's where the collaboration comes within VSA and the Minister of Education to ensure that these things are done and that we can tackle this and have, because at the end of the day, certain children are born into certain situations, right? And they just seek the help that they need. So those are basically the questions from my end, Minister. And as I mentioned to your SG as well, you know, as a former social worker, I'm always available as well, free of charge, to assist in any way that I can as well. So thank you, Minister. Thank you, Madam Chair, for allowing me the floor.
Thank you, MP Weaver. I now invite MP Veronica Janssen-Webster to take the floor.
Thank you, Madam Chair. Good afternoon again to my colleagues, and welcome and good afternoon to the Minister and support staff, to the people listening in the Tribune and at home online. My first question to you, Madam Chair, to the Minister is, I have taken note of the Minister presenting a capacity assessment findings. If the Minister can send that document to the Parliament, because I think that there are a lot of, thank you so much, sir. I think that there are a lot of, there's a lot of information in there that's not in the presentation that was submitted by the Minister, and it would be good if we could get those details as well. So if we could receive that capacity assessment findings document in Parliament, dated May 2025. Then I too had a question about the money that was allocated in the 2024 budget amendment. I can say that I did not hear the part where the Minister said that the previous Minister, being myself, did not sign off on whatever advice. However, I know that I was very proud when I saw the line item in the budget that was named mental health, and then there was the funds allocated there for mental health. So I don't think that there was an advice that was needed. And so my question to you, Madam Chair, is the money that was allocated in the 2024 budget amendment specifically for mental health care, can you state what was used of it in 2024 and what was it used for? And also, if that budget is still there in 2025, so I would like to know if the budget is still there in 2025 for mental health. I think the Minister did state in his presentation that money is there. What will it be used for? And if it has been used already, what has it been used for? Because I also heard the Minister mention various programs and projects that were done for the mental health of the staff within the ministry. I know that in the past I read that the Minister indicated that the staff was neglected by the former ministers. So it's very good that he now is taking it up and treating the staff well, because I have always said that the staff in the ministry, one of the best staffs in government. So the workers, one of the best set of workers in government, the people who work for the ministry, and since they've been severely neglected, and now we have all of these programs, I was wondering if these programs, if those were funded with the funds for that was placed there for mental health. So if the civil servants were funded through that. When we visited the mental health facility as Parliament, we learned various things. For instance, it is our understanding that when mental patients are not insured, that the Mental Health Foundation foots the bill. I was wondering if it would be possible if through this mental health funds that are were on the budget, if we could look into assisting with funding, with footing the bill for the mental health patients who are uninsured, because it's not all that many. However, it is important for the general community and the safety of the community that mental health patients get the care that they need. So to ensure that everyone in the community gets the care that they need, if we can use some of that money from the budget, then for mental health patients who are uninsured. And then I was glad to hear the minister talk about autism. I know that he was there at the conference with on autism, and it's not only autism, but autism and Alzheimer's that falls within the mental health section. And I was wondering also if there are any subsidies for the Alzheimer Foundation, what's it called, the autism box. If there are any subsidies planned, whether it's incidental subsidies this year or subsidy for 2026 for Alzheimer and for autism foundations. This would aid definitely parents. At the conference, we heard of parents speaking about the challenges in having their children only being able to attend 30-minute sessions, therapy sessions per week. So this would aid, for instance, in something like that. And I think that those parents will be very happy if we could, and especially if there is money, if we could then assist and support them. The Spectrum Support Box, that's the organization as I was talking about. And then I too had a question about the staffing. You mentioned, Minister, that the person in the ministry is leaving, and I was wondering if the newspaper recruitment that I also saw, through you, Madam Chair, of the recruitment that was in the newspaper, if that is to replace the person that I know that was there in the Secretary General's staff bureau, and if that's the person who is leaving, who was dealing with mental health and NRPB before. So if this new recruitment is a replacement actually, and not an extra person. And the minister also highlighted the increase in youth mental illness issues, 15 years and younger. Currently, our laws do not regulate the treatment of mental health patients in this age category. And therefore, there is a need for a change in legislation to enable the treatment of these young people. We learned this also during our visit. And I wanted to know if the minister, through you, Madam Chair, can mention other areas in which there is a need for change in legislation when it regards mental health. We have learned, for instance, during our visit, that there is no possibility to keep babies and young children with their mother, even if all she needs is incidental mental health daycare services. It was not clear in your presentation, Minister, through you, Madam Chair, if there will be a female section or a family section in the new mental health building. So that is my question. Will there be a female section or a family section, making it possible that families don't have to necessarily be split up if the parent just needs a little assistance with a daycare? That will be all for now, Madam Chair. Thank you very much.
Thank you, MP Janssen. And members of Parliament, are there any other speakers? As MP Janssen is the last one on the speakers list. So I would want to assume that that is not the case, and I am going to adjourn this meeting briefly to caucus with the minister. Meeting adjourned. Members of Parliament, ladies and gentlemen, welcome back after a brief adjournment following the questions by the members of Parliament on the topic of mental health and the presentation that was received at the beginning of this meeting from the Minister of VSA, Minister Brugge. At this time, several members of Parliament have posed questions to the Minister. In a brief caucus with the Minister, I have asked for the time estimated for the Minister to come back and respond to these questions by members of Parliament, and I have asked the Minister to do his best and try to, at least within the next 7 days, a week or so, be able to respond to the members of Parliament. I think that we tend to lose the focus of meetings and topics when the answers by the respective ministers are put off for a very long time. Hence my request to the minister to try and respond as early as he possibly can. And thus now the minister is going to indicate what is that earliest possibility for responding, as well as give a clarification, I believe the minister indicated, to a matter that was raised. So, Minister, at this time, you have the floor.
Thank you very much, Madam Chair Lady, members of Parliament. Just one clarification is that pertaining to the question asked by MP Jansen-Webster, that MP is correct, that the funds are secured and it's still secured, and we are right now in the process of actually transferring the funds directly to the Mental Health Foundation. So the funds that I mentioned earlier are still there, and we're in the process of transferring the funds. I would also like to add, thank you very much to the members of Parliament for the questions asked. I honestly believe and I honestly encourage that members of Parliament continue to be engaged in this topic. I will come back with the answers to all the questions, and if there's any follow-ups after that as well, I will also continue to contribute. It's very important for me, as I stated in the beginning, that this issue is not a VSI issue. This issue is not a Sint Maarten government issue. This issue is a Sint Maarten issue, and together I believe that we can resolve the issue. Thank you.
Thank you, Minister Brugge, for that clarification. And with this, members of Parliament, ladies and gentlemen, I am going to adjourn this meeting until hopefully next week or so, day and time to be confirmed between our secretariat here and the minister's office. So, members of Parliament, I thank you for your participation, Minister, and your support staff, as well as all those who were tuned into this meeting. Thank you, and I hereby adjourn this meeting until further notice. Meeting adjourned.